Hi, my name is Caitlin, and my genetics project is on oculocutaneous albinism 1. Here's my table of contents that I will be covering throughout the rest of my presentation. We'll be going over genetic origin of albinism, inheritance, effect and distribution, symptoms, treatment and financial considerations, resource information, changes in home, and support groups. So to start, what exactly is albinism? Albinism is an inherited condition associated with an absence or decreased production of melanin. Melanin's role is to give skin, hair, and eye their pigmented color. Therefore, albinism is a result of altered skin pigmentation affecting the hair, skin, and even your eyesight. There are multiple different types of albinism, but the one we will focus on today is the oculocutaneous, also known as OCA. This type of albinism only affects skin, hair, and eyes. A little about the genetic origin of the OCA gene. The OCA gene is caused by mutations on the tyrosinase gene on the chromosome 11q14.3. Mutations that attack the tyrosinase activity will result in the OCA gene causing a complete or partial loss of pigment. So going back to what I previously said about melanin and the role it plays in giving our hair, skin, and eyes the normal pigment, it is clear that the mutation on the tyrosinase activity causes the appearance and the lack of melanin production. Is OCA1 inherited? The answer is yes. It is passed on in an autosomal recessive inheritance pattern. In simpler terms, this means in order for the child to have this condition, they need 2 copies of the gene that carries albinism. This means one from the mom and one from the dad, one from each parent. A little bit about the effect and distribution of oculocutaneous albinism. To start, the OCA mutation affects the proteins that are responsible for melanocytes making melatonin pigment. This then causes the lack or absence of pigment to the hair, skin, and eyes. This is why we see fair skin, fair hair, and light-colored eyes in our patients who have the condition of albinism. In addition to this, albinism is a mutation that leads to defective melanocytes that can't distribute melanin to the dermal tissues. If melanin cannot reach the dermal tissues, this is what would cause the change in pigment or the lack of pigment in our skin, hair, and eyes. Mutations to the tyrosinase gene leads to a loss of eumelanin. This impairment directly affects the maturing process of melanosomes, thus resulting in the defective pigment and the altered appearance. OCA1 is known for their symptoms that affect the hair, skin, and eyes. Hypopigmentation of the skin and hair is most common when people think of albinism. This is where there is a lack of production of melanin that causes the altered appearance of fair skin and hair. With OCI and those that have this condition, they are at a high risk of eye problems. This includes decreased sharpness of vision, astigmatism, strabismus, and photopia. There is also a chance that you can have very light irises if you have this condition. The iris is the colored part of the eye, and because of the lack of pigment, this alters the appearance of the eye and even the color, making them very light instead of the normal brown, green, and blue that we are used to seeing. So you may be wondering, who exactly is at risk for oculocutaneous albinism? Researchers and studies show that every 1 in 40,000 people yearly are affected by OCA1. OCA1 is the most common form of albinism, and studies also show that those within the African American populations are less likely to be affected by this disorder. There are multiple healthcare professionals who have more knowledge and experience when dealing with a patient who has this condition. Starting with dermatologists. Dermatologists are skin specialists. This is extremely beneficial for patients with this condition because due to their fair skin and lack of pigment in their skin, UV light and the sun can be extremely harmful and damaging to the skin. Thus, having a dermatologist who can advise them to special skin products such as sunscreen or lotions that can keep them healthy is extremely beneficial and highly recommended. The next healthcare professional is ophthalmologists. These are eye specialists, and these are important because, like I stated above in our symptom slide, those with albinism are at high risk for eye problems, such as decreased sharpness of vision, nystagmatism, and phototopia. It is important to get proper eyewear, glasses, even sunglasses to protect them from certain lights or even help them with their vision and keep their eyes healthy. And finally, the healthcare professional that would be extremely beneficial to anyone who is a parent to a child who has this condition or an individual who has albinism themselves is a genetic counselor. A genetics counselor's job is to assist with treatment decisions and testing decisions and kind of just educate you on the best option for you personally or for someone that you are caring for. And it is just another support system and another way to educate yourself on what this genetic disorder is. For albinism, there are sadly very limited treatment options. This is because this condition is irreversible and you cannot get rid of it. But with that being said, there are some treatment options that can help improve your quality of life when living with this condition. This includes treatments to improve vision, such as glasses or contacts. It is often recommended that you go to frequent eye tests, so this can be done with an ophthalmologist. You can also wear sunglasses or sunscreen that can help prevent further sensitivity to the eyes and to the skin. A little bit about the financial information about the treatments that I listed above. So starting with our eye treatments, glasses on average cost up to $400 and contacts can range anywhere from $200 to $500. With insurance, it usually covers your annual eye checkup with your ophthalmologist and sometimes the cost of glasses or contacts. With skin treatments, skin products such as special lotions or sunscreens don't cost too much and can usually be bought over the counter or prescribed from your dermatologist. Insurance, again, will usually cover the cost of seeing your dermatologist annually, but there are resources to go ahead and access some of these treatments if your insurance does not cover it or if you don't have insurance. So moving on to recommendations from our doctors to those who have this condition. They recommend a high SPF sunscreen for those with OCA. These can be found over the counter or even prescribed by your doctor to get a higher SPF. They highly recommend UV protected sunglasses, and these can be found at your nearest stores like Walmart, Target, or even Amazon. Finally, contacts and glasses, which can be prescribed through an ophthalmologist. If you're looking for an ophthalmologist recommendation, you can find one through your insurance provider or a doctor. There are some certain financial considerations to take into account. There are individuals who are suffering with albinism or caring for someone who has the condition that may not have adequate medical care. Thus meaning they may not have proper access or insurance to cover a dermatologist or ophthalmologist. Without proper medical care, the cost for glasses, contacts, UV glasses, and proper skin products can be pricey and out of reach. This can, of course, alter the quality of life and the difficulty when living with this condition. There are very minimal changes to the home setting for someone who has this condition or for someone who is living with someone with albinism. Like stated above, this condition causes vision impairments, so eliminating safety hazards such as throw rugs or cords under the rugs would be very beneficial, and even adjusting the lighting inside the homes, making it brighter and easier for the person to see, or dimming the lights to help with the sensitivity of the eyes. Support groups are highly recommended for those who have OCA1. Albinism can cause many mental and physical challenges due to the fact that there is a misunderstanding of the condition from the outside world. There's the Albinism Fellowship, which is a support group who provides advice and information to those with the condition or those living with someone who has the condition. There's also the National Organization for Albinism and Hypopigmentation, known as NOAH. This is another huge support group. They offer family summer camps, conferences, teleconferences, adult weekend excursions, and webinar series. In addition to hosting support events, they also offer scholarships to students with the condition. Counselors and therapists are also a great resource. They can help during situations of emotional issues and assist families and those with the condition throughout it all. In this picture here, this is what OCA 1 looks like. We see the fair hair, the fair skin, and if you look closely, you can kind of see the light irises and the light pigment in the eyes. So wrapping up with my presentation, OCA albinism is a condition where the presence of melanin is lacking or absent. It affects the skin, hair, and eye colors, while also causing many other complications with the eyes. This condition is very misunderstood, and they face a lot of discrimination and rejection because of the stigma and stereotypes surrounding the condition. There are no treatments to cure this condition, but there are a few to help reduce the symptoms and the risks. Support groups and therapy are highly recommended to deal with the emotions that the OCA condition brings.